for outcome one. We're nearly there.
Okay, thank you again for coming. Your agency's response to my last estimates questions indicated that the uptake of My Health Record in aged care organisations is only 3% and less than 8% for medical specialists. Surely this low uptake in aged care represents a significant risk to the many Australians in the 8,253 facilities and organisations that have not signed on. How does a medical specialist know how to treat people?
Thank you, Senator Batten-McMahon, Acting Chief Executive Officer. We'll take your question in two parts. One, to provide you an update of connection of aged care facilities to the My Health Record. My Chief Operating Officer, Rupert Lee, will provide that, and then I'll address the second part of your question around the utility of that.
Okay, thank you.
Rupert Lee, Acting Chief Operating Officer, Digital Health Agency, Senator. We currently have 252 residential aged care facilities registered with the My Health Record system. And in terms of specialists, we have 796 registered medical specialist organisations registered, which is up from 731 in September.
So what was the number now again?
796, Senator.
Up from 731?
Yes.
Thank you.
And I'll note that those are specialist organisations, so organisations, usually specialists in their rooms. That doesn't count all of the specialists who access the My Health Record through hospital systems, whether public and private. So we'll have more specialists actually using the My Health Record, which are captured in those figures as well.
So what's your agency doing to increase the number of organisations?
Yeah, Senator, we have a specialist, medical specialist program in flight at the moment as part of our 1920 work plan to increase My Health Record use by specialists in private practice and in emergency departments in hospitals across the country. It's delivered so far engagement with over 100,000 specialists, delivering 45 My Health Record information sessions across the country. And we're also contracted 9 software developers, specialist software developers, through an open industry offer to incorporate My Health Record conformance into those products.
Okay, thank you. Last question I have is about the data storing. Private medical information is sometimes or often stored in the cloud by clinicians, and if this data is stored overseas, the protections and privacy controls may be different. What can the government do to protect the private medical records of everyday Australians from being harvested and used possibly against them? I'm told there are only 2 storage areas. One is in Indonesia and the other is in Belgium. Are these records covered for security or access under laws that are compatible with our standards?
I can comment on the My Health Record initially and then health data more broadly. So in relation to the My Health Record data, the My Health Records Act requires that the data is stored in Australia. So that's all stored onshore, and so all of the Australian laws and legislation apply. In relation to health data more broadly, that is managed either by the private health sector or other healthcare providers. They're covered by the Privacy Act, and which requires comparable laws that you mentioned in terms of data storage.
Okay.